Hi, I'm Dr. Cole Cheney, a pain medicine physician with Mayo Clinic Health System. Today, I'm here to tell you about Mayo Clinic Health System spine care, what it is, and how it may possibly benefit you. This was an idea born out of Rochester and further developed within the health system, whereas patients were getting a lot of shotgun referrals. In other words, they would tell their primary care doctor, I have back pain. The primary care doctor, appropriately concerned, would do things like order imaging, perhaps a neurosurgery consult, sometimes a physical medicine and rehabilitation consult, a physical therapy prescription, and a pain medicine prescription. This is all well intended, but oftentimes a patient wouldn't know perhaps where to start or where to go. This created a streamlined process that allows patients, once they've activated the spine care route by their provider, they are then funneled through a triage system that then allows them to be put in the proper category and expedite their care. This could look like perhaps a patient who needs more imaging. Well, that could be done before they have to see the provider. Perhaps it's a more urgent issue and necessitates urgent surgery. This would allow them to bypass some of the other previous providers and go straight to see a neurosurgeon. And the opposite is often the case, where surgery would not be indicated. The spine triage center would review this and then get the patient to the proper pain medicine or therapy referral. Another way that our clinic offers specialized and individual care is that we have incredibly smart people, trained at the top of their scope and oftentimes subspecialized in a field specific to the patient's problem. Because of this, we're able to offer a cutting-edge and tailored treatment for each patient. During your initial spine visit, you can expect to be evaluated by the correct physician because your case has likely been triaged before you even showed up. Because of that, you'll either be routed to a physician who works in neurology or neurosurgery. Perhaps it would be pain medicine or physical medicine and rehabilitation. No matter what, this evaluation would be holistic, complete, and if they felt like they needed to get more help from other spine center colleagues, you'd be properly referred. This actually reminds me of one story that I want to share. We had a patient come in through the spine center self-referred. I'm a pain medicine provider, and we thought he was being worked up for pain. When I evaluated him, however, he had some motor weakness on exam, which is a major red flag in spine care. Rather than have to send him out to a different clinic or a different hospital, I actually asked him to wait in the room for a moment, walked down the hall, and found Dr. Sharma, one of our neurosurgeons. I explained the case and went over the imaging with him. He then went directly to the patient's room and consented them for a neurosurgery. The next day, the patient underwent a neurosurgery that relieved the pressure on the nerve that was causing problem. The patient then went from being unable to walk within a few days. This is a great example of what true holistic and team-based spine care looks like. To learn more, please click on one of the links on the screen or in the description below.